Okay, so as we wait a couple more minutes for everyone to trickle on, I just wanted to start first off, thank you to everyone for taking your time out of the evening to be here with us. And most importantly, thank you to Dr. Murthy. I can only imagine how busy your schedule is, so it's greatly appreciated. I did want to provide just a little bit of information regarding this webinar specifically, as well as the whole series. So I am one of the FAMWA ANSI Carter Fellows, and a little bit about the fellowship. It's a 2-year fellowship designed to provide hands-on experience for medical students who want to strengthen their knowledge and enhance their global health skills as professionals. It is, I guess 3 to 4 of us are selected each year, and so there are a couple other fellows on here with me. And the intention behind the program is that your first year focuses on a local project, and then your second on a more international project. And so we've, like everything over the past year, we've been flexible in switching that up. But I come from a school that doesn't have a formal global health program or track. And so what that did was inspire me to create more virtual opportunities for students who might be in a similar situation and lacking that mentorship component of global health. That's so crucial to planning trips and just knowing if any type of the diverse global health opportunities would be something that you'd want to pursue as a professional. And so for me, this webinar and the webinar series that I'll hold throughout the year is going to be my local project. And Dr. Murthy is actually the faculty advisor for the FAMWA Global Health Program, as well as the ANSI Carter Fellows. And so again, thank you for taking the time out of your schedule to be here with us, Dr. Murthy. The format for tonight's presentation, I'll introduce Dr. Murthy, and then she'll speak for around 30 minutes. And then the reason that we're not gonna do slides is we want this to be a little bit more conversational. So as she's speaking, if you have questions, feel free to unmute yourself when appropriate, or just type your question in the chat and I'll be keeping an eye on that and I can speak out loud for you if that makes you more comfortable. And then the second half, we'll open up the floor for a question and answer session. And then if there's any time left, I'll let Dr. Murthy provide just advice that she has for us, for students who are considering pursuing a career in global health. And so, Dr. Murthy, let me just say this to you. I am blown away by your CV and resume. So Dr. Murthy is a professor and global health director at New York Medical College School of Health Sciences and Practice. She's a physician and activist who completed her residency in obstetrics and gynecology. She's practiced medicine and public health for the past 28 years in various countries, as well as like specialties in both divisions. And some of her work includes the MWIA, the Medical Women's International Association, NGO representative to the United Nations, the International Health Section of the American Public Health Association, which is one of the largest associations of public health professionals in the world, Secretary General of Medical Women's International Association, which is a 100-year-old professional organization, and first Vice Chair of the Global NGO Executive Committee. She has won many distinctions and awards, including the Elizabeth Blackwell Medal from FAMWA for her work in promoting women's health globally. And so with that, I will open it up to Dr. Murthy. And then again, if you have any questions, feel free to unmute yourself when appropriate or type them out in the chat.
So hi, everyone. Thank you so much, Katie, for that introduction. And so the reason when I was talking to Katie, we decided not to have slides is because to have this kind of conversational. And after some time, we all get zoomed out because we're looking at slides and then we lose what the person is saying. At least I find that. And, we're all, I sent a message to a friend asking him, are you zoomed out? He said, no, I'm constantly zoomed in. So that being said, even in this time, we can still be activists. We can still be advocates. And one of the things what we've been doing from AMWA, and also, it's great all of you are there, but I would like to give a shout out to Bobby because it's just not an all-female crowd. So, and we do believe in gender equality. So it's just not men who are chivalrous, women can be chivalrous too. So that being said, it's not that I don't appreciate all of you other people like Tara, Zara, Alexis, Leah, Nina, your camera is off. Sahib Noor, I hope you got, and Alicia. So that being said, and did I miss out anybody else? Well, if I did, I thought I saw somebody else. I guess she left. Okay. So what I wanted to say is, so even during COVID, we can still continue what we are doing, like global health with the local effect. And also, Nina's at the hospital. Okay, Nina, thanks for joining in. So I just want to tell you what we did from American Medical Women's Association. As you know, we have been around for the past 105 years. And one of the things about AMWA is it's all women physicians. The reason AMWA came into being, because, AMA is there. It's not that we are bashing men, but women were not being given enough, what shall I say, a seat at the table. So what did we do? So one, during this, what we did is we partnered with another NGO, which is a religious NGO. I've worked with them in the past, called Suchi Foundation, and with the private sector and with the DA's office in Arizona. And guess what, folks? We delivered over 80,000 masks to the Navajo Nation. And let me tell you, PPP, because, Navajo Nation is really being ravaged by COVID because they don't even have running water. We think it's in those countries, but we don't realize a lot of times we face the same challenges here in this country. So Navajo Nation. Now, let me stop there for a minute. So this is the power of teamwork, because it's not that just like I did it or Dr. Eliza Chen did it. I mean, we call each other partners in crime because we are the ones like running around doing all this. And I'm the global health lead of AMWA. But one of the things is it was teamwork. It was coordinated. The reason I bring it up is because there was the NGO we work with, there was the private sector who gave us these masks, and there were the pilots who dropped them off free on the plane. So, and then we work with students. So that's the whole thing. And hopefully, I'm not bringing up politics, but I need to, hopefully we get actually a vaccine rollout which works. So to me, teamwork is very important. So when you're looking at doing something, have a timeline. How do you go from A to B? Remember, from A to B, you may have to go to A.1, A.2, A.3 before you go to B. But then from B, you may be able to go to C without these intermediary steps. The reason I'm saying that is because we need to strategize. And you need to be on the top of things. It took a lot of persistence. So that's one thing we did. Now, how many of you have heard about the Sustainable Development Goals by the United Nations? Now, if you're interested in global health, one of the things is you need to know what the Sustainable Development Goals are. These were agreed upon at the end of the Millennium Development Goals in 2015 by the member states at the United Nations. And goal number 3 is what is important for us as healthcare people, because it's looking, it's to make sure everybody has health at all ages. Goal number 3, good health and well-being at all ages. But let me tell you, it's like, when you're exercising, you just can't say, oh, I'm lifting my only weights with my right hand, but why is my left hand weak? So everything needs to be like a 3-dimensional puzzle. So even though we are working for, thank you, Katie, for posting that link. So for everybody who is working on promoting health and well-being, you cannot do it without looking at the social determinants of health. So post-COVID, because I don't know when we'll get to post-COVID, folks, we are still in COVID. It's like COVID-1, COVID-2, COVID-3, ongoing COVID. So we need to look at the social determinants. Now, there's one thing interesting. have you seen why Taiwan has been so successful in addressing? It's a beautiful case study of public health and global health, which because of politics, it's not shared, in the UN because of all the ongoing politics between China and Taiwan. But the reason I'm bringing up Taiwan is they have done a fabulous, what shall I say, a fabulous job. And in spite of the close proximity to China. Why do you think this happened? If we look at it very simply, three things. There was political will, there was coordination, there was a very good response, and they had a great timeline. Now, the other thing is we do have, unfortunately, not all countries have the political will, because one thing, public health and global health are so influenced by politics. So that's something we need to have at the back of our mind when we are looking at any kind of strategy. Because unless you know the players, unless you know the environment, that's why I brought up the social determinants of health, we cannot succeed. The other thing is Taiwan, Singapore, Japan, Korea, they were much prepared than a lot of the Western countries because they faced the SARS. So if you travel to any of these countries, people always wear their masks. It's not taboo. So if you don't wear a mask, they look at you like you're a weirdo, like, you're from some other planet. So that is the thing. And also every family was given a bag of PPE every week. That was one of the things they did. And there was a health card. So if you ran out of your supplies, you could go and get it. So it's also universal healthcare. The reason I'm bringing that up is the pandemic of COVID pandemic, and it's not the last pandemic we're going to see. I hate to say it. I'm not being pessimistic here, but I'm just giving you the truth, the facts. So we need to understand, what do we do? So we need to have a better prepared system. You need to strike when the iron is hot. And also, yes, Nina, thank you for sharing that. We did a webinar with Taiwan, and we've done a lot of webinars on FAMWA. I would strongly suggest you go to the website, sign up for that, because it's worth seeing. We talk with different physicians from different countries as to the response for COVID. Now, coming back to that, one of the other things, what we did from FAMWA is, remember when Italy was so affected with COVID? Well, we sent them pulse oximeters because they did, even if we sent them money, they could not. So we talked to, again, actually this young man was one of my daughter's youth colleagues at the UN and one of her friends. So we talked to him. And so I'm just telling you, so he was able to ship out PPEs we shipped out, Dr. Chen and I, on behalf of FAMWA, and also some masks. Remember, there was no way we could send anything else because we have a moratorium, like you cannot send off a ventilator because this was the time when this was peaking. Even now, I don't think we can send ventilators because it's also difficult, So what I was trying to say is, even it's small. I mean, that's what I tell a lot of students when I'm asked to speak. You don't have to be a billionaire like the Gateses or Warren Buffett. Small things you can. For example, you can give up your coffee. That's what I tell my students in New York Medical College. One day, give up your Starbucks, give up your cappuccino, give up your latte. That money is so. What we did is we raised funds and worked with the former First Lady of Malawi to build a maternity home there and sent over 500 safe motherhood kits. Because what happens is, the reason I bring this up, this was pre-COVID. Even pre-COVID, they did not have masks. They did not have ties. They did not have gloves. They did not have soap. I have delivered women in terrible situations. And a lot of times when there were gloves, you can't tell the baby, hey, go back. I'll wait till I get gloves. So improvise. I used to be a Girl Scout. So we use plastic bags to deliver babies. The reason I'm saying this is, necessity is the mother of invention. So tomorrow, I mean, it's great that you're all there. And if you can come up with the elevator pitch, this is what I always say. If you're stuck with somebody in an elevator or you're traveling in an elevator, what would your pitch be that they could support your effort in global health? They could give $5, they could give $10. One of the other things what we did is my students, they had a page on Amazon. So instead of giving gifts for Christmas, Hanukkah, Diwali, or Eid, like you give the money for a project you come up with. So the Safe Motherhood Project, which not only my students in New York Medical College did, then when I spoke to some students in Albany, they did it. So, and then somebody else in Texas did it. So why I want to say advocacy is so important. You don't have to be yelling and screaming like the rioters. I don't think any of us would do what they did on the Capitol Hill. But what I'm saying, advocacy can be very subtle. It needs to be in waves. It needs to be strategized, even in time of COVID. Now, one of the other things which FAMWA was involved in, because, when I do something, it's like I say, yeah, I'm doing it on behalf of FAMWA. Well, how many of you have heard of Mother Teresa? I'm sure all of you have. There is a Mother Teresa in home in Calcutta, which cares for these people. And I have worked with some of my Indian colleagues where we have given them a safe, motherhood kits, maternity kits. So what happened is a lot of the people, because of the lockdown, they were not getting food. So they reached out to, again, this Buddhist foundation. So we talked to another person who was able to send rice, lentils, wheat flour, potatoes, and onions, because they would stay. So 2 months supply and 10,000 PPEs and soap. So all this was sent during COVID. How did we do it? Well, it was done by us in the US, coordinating with Taiwan, coordinating with Canada, coordinating with India, talking to the local suppliers to send this. So the reason I say this is you don't always have to ship things from where you are. You need to talk to somebody. That's why it's important to network. That's why I tweet. That's why, on Facebook, it's just not like what did Melania Trump wear? I mean, who really cares? I mean, I don't. So the reason I bring that up is like we were so all consumed the media with what this one wore and what that one wore. But why aren't we focusing on what we can do? And you people, like your generation, has access to so much more than we did in my generation. Because when we went to medical school, we didn't have half the stuff you guys had. But that being said, there's a way of doing it. So what I would suggest is, like, as a bunch of people, think of something. How can you help somebody? It could even be by picking up the phone and talking to somebody, because, or, via Zoom, via Google, excuse me, Google Rooms or Twitter, just checking in on somebody. And also, this is so important. So some of the things what we did in FAMWA, the other thing what we did is we partnered with an NGO called Robotics or something. Yes, which is founded by one of the students who's in our pre-med division, and printed 3D face masks, which were shipped out. So we raised funds for that. So you have, because a 3D printer is expensive. So it was really nice. So the 3D masks came in handy, because remember, we still have a shortage of PPP. The other thing we did is, apart from this, again, you might be thinking I'm obsessed with PPE, but there's so much of a shortage, especially for us healthcare providers. And I've had colleagues and friends from Nigeria who were crying, saying, is there any way we can have access to masks? Because she said she was using the same mask for like 10 days, day in and day out. And it was just the surgical mask. It was not even an N95. Can you imagine, like, you're seeing the same patient? So this is a problem. Gloves and also this. The other thing, we reached out to people in Taiwan, and they shipped out like within 3 days, like over 2,000 masks and face shields. Do I have one of them lying around? Yeah. So which we shipped out. Again, we sent it to a lot of these to our colleagues. We sent it to our colleagues. So one of the ways to work is you harness the private sector, the government, use your contacts, because this time, and Amber, we've been, also reaching out, like all the webinars we have. So it's really important. That's how we get in touch with people. The only thing is, when you're doing aid work, make sure you have every T dashed, every I dotted, because especially if you're dealing with money. Now, it's simple. It's much easier for us if people directly send supplies, right? As opposed to giving us money to buy supplies, because it always needs to be transparent. That's why, anybody asks us what was sent here, what was sent there, all the books. So even if it's a small project, even though if you're doing it in your local church, your local temple, synagogue, mosque, anything, or just in your local club, or maybe with one of the clubs. So this is what you need to do. Like, I've worked with Rotary in the past. The other thing, Amber, we do is we recycle medical equipment, So what do? We have an inventory and we send it out. We've done that. And then a couple of years ago also, there was a shortage of, again, there was an epidemic of chikungunya. How many of you have heard of chikungunya? It's a virus. It's great. Bobby says he has. I didn't see. You too? Have you heard of it too? Okay, great. So it is caused by mosquitoes. It's pretty debilitating. And there was a severe shortage in the country of Grenada, which is in the Caribbean, of NSAIDs. So I launched with my students a drive. And do you know, we sent, I think, 300 bottles of NSAIDs in 1 week, because worked with the UN mission, went there, dropped it off. So it went in the diplomatic pouch. See, that's the advantage. If you work with some people in the diplomatic corps, because they can send it out and it reduces the money you spend on shipping. Or also, if you work with organizations like AFIA is an organization we worked with in the past in New York. It's an aid organization. It's AFAYA, AFIA. And when they have enough for a container, they reach out to donors, so that, like, after the Nepal earthquake, remember the Nepal earthquake? So we sent like a wheelchair, because I was talking to my PT students in the university, the physical therapy students, the cam boots and other walking sticks and visual and other aids and warm clothes and a whole lot of stuff, which we sent to Nepal, including sanitary pads, which we sent to Nepal, and through AFIA, because what happened is, when the students raised funds by giving up their coffee, their lattes, they do that all the time, and they're not mad at me for, saying that, oh, give up your latte. So we go there, and then, so this was sent. So that, I think I saw a question from somebody, I think Bobby, it just popped up, something about a charity. I'll address the questions once I finish talking about this. So remember, even with local effects, we can make an impact locally or even globally. So, and global health. So what I hope, like I always tell, anybody, and I think I kind of lost count of the number of times I talk to people, and don't think I repeat the same thing over and over again, but to see, if you really want to make a difference in global health, you got to get your hands dirty. Otherwise you can't. It's not like reading off from a book. So what do? You need to go, if you can, post-COVID, hopefully, go and join the medical brigades. I'm sure your medical schools have them. Go there, work for a week or so, because it's so important. And that gives you an idea, because that helps you do a needs assessment. Now, coming back to COVID, so what can we do? Well, first of all, we can do so many things, even reaching out to somebody, I said, because people are so sad. Like so many people have even committed suicide. As we know, the World Health Organization says health is a complete state of social, mental, and physical well-being. And everybody's social and mental well-being is definitely affected. And now I was talking to one of my friends and I think we all need to have some therapy because we are so scared. Like, I went to the post office 2 days ago and I just had to wait outside. I usually, because of the long line, and I'm like, oh my God, this person is coming. Is that person 6 feet away from me or more? Especially there's a new variant. Okay, I've had one shot. I'm waiting for my other shot. So what I'm trying to say is, even though we are health professionals, we are supposed to be knowing and not be so scared, but we are basically social. Humans are social animals. We need to get out, we need to talk to people, so it's really hard. So one way of connecting is great, Zoom. Even though we do say we are zoomed in or zoomed out, or we are googled in or googled out, but it's still. So can you imagine 100 years ago when the flu came, which wiped out so many people, how did they keep in touch? So we have so many tools, but again, bottom line, well, I really hope, because of your interest in global health, that you actually go there. And not everybody wants to practice making $1 million a year, which seems to be a far off dream for physicians now. Let's not even get into that. But what I'm trying to say is, you need to understand. That's why it's a social determinants of health. It's like, what is the needs assessment? What do they have? What can I do? And one thing I have found in my almost 30 years of working in global health, you need to work with local partners. Otherwise, you won't go anywhere. You need to be accepted. It's not that this person coming from the United States or UK telling them blah, 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 this is what I know. You need to find a local partner and they teach you as much as you. The other thing, use local foods. I worked with an NGO a couple of years ago. In Johannesburg, we came up with a training the trainers, where we taught the mothers, especially now, like you can use, what do you call it? Molasses, which is the byproduct of sugar, which is it's also called jaggery. It's very high in iron. So that's a way of, pregnant women, anemia, getting this. So I'm just trying to say, so this is what you need to be looking into and thinking about and everybody starts, like, when I first started, thought like, oh my God, can I do something? And then once you start doing that and finding like-minded people and believe in it, because if you sincerely believe in it, yes, you can do it. But the important thing is to be practical and not thinking like, I'm going to do everything like, one day. It's, as I told you, it's a gradual process. You need to make people aware. The last thing I'm going to say before we have or open up for discussion is the other thing Amber is going to be doing with one of the first ladies of one of the countries in South America. They need recyclable pads because there's a shortage of pads. So we are talking to some people, and after that, Katie, I'll be sending you, Nina, and the global health people. So if there's any way, I would really like students also to be involved in this, because it goes a long way. Because the worst indignation is not to have access to a pad, and it's become even worse now during the COVID. And I met this young woman from Pakistan. I have to send her a message again, who had special needs, and she came up with an app because, in a country like Pakistan, they have so many restrictions where women could not have access to their sanitary pads. And, if you say the term sanitary pad, it's like you're using a curse word in so many countries, societies. So, but it's like men need to talk about it. So it's important. Because, when somebody looks shocked, I said, okay, well, if your mom didn't have a period, you wouldn't have been born. And they go like, yeah, you're right. I said, yeah, it's physiology, So that is something which we need to talk about. So don't be afraid, because, being respectful, we can talk about taboo subjects. So that's the thing. And also, when we have the advantage we bring to the table is we are healthcare professionals. So we are not talking about investing or, doing a startup and giving people tips. We're talking about what different simple measures can be put into place to improve somebody's health. And I have found that when I was a consultant in the UNFPA, I have consulted with the UN on and off, is one of the things when we worked on HIV prevention. The reason I'm bringing all these up because women's reproductive health has been totally affected during the COVID. So we used to talk to the local churches, the local mosques, the local temple leaders to tell them, by talking about contraception, we are not promoting promiscuous sex. We are not encouraging teenagers to have, it's stupid. Teenagers have sex. We need to talk about it. We need to accept it and not say like, oh, they don't do it. No, they do it. Like if you think they don't do it, you're dumb. So what I'm trying to say is you have to involve the community people, the religious people, and it's the messaging. KIS, that's my motto. Keep it simple. So when we told them that, they were happy and we could talk about the barrier methods of contraception. So it's the way you put it. It's like telling you, oh my God, this thing is empty. I got to refill it. And saying, you know what? I still have half a container of half my bottle of water. So that'll suffice. So these are some things I just wanted to say. And the reason I was talking about this, because this will all come in handy when you're thinking of a project you want to do, and put your thinking caps on. You come up with so many ideas and share them. And I think I saw a lot of questions or comments flying around. So now I'm going to stop. And if anybody has any questions or comments, we'll go from there. And I hope you do get something from this talk.
Thank you, Dr. Murthy. I really enjoyed how you brought that back to our level in ways that we could be involved now, but that's also applicable throughout our careers. In scrolling through the questions, one of the first ones was from Aaliyah, and she's very interested in hearing how to use Amazon to collect and help other nations, like you had mentioned with the Navajo Nation. And Bobby, Aaliyah and Bobby, feel free to unmute yourselves if Bobby's response was able to answer that, or Aaliyah, do you want Dr. Murthy to speak on that a little bit further?
Sure. Good evening, everyone. Thank you so much, Dr. Murthy, for your time. It's been an honor just hearing you talk. I am so impressed with you, and I look forward to becoming an OBGYN and also serving people not just in this country, but hopefully in Cameroon, West Africa, and then in South Africa. But anyways, I think Bobby did answer my question, and I went to the link and I'll check it out some more. And I think also I commented later about being interested in any of the projects that you might currently have that students at other medical schools can get involved with. I would love to share the information with our medical schools organization, just to try to get them involved as well, because we have been scrambling. We have been thinking that it's a pandemic, what can we do? And just hearing you talk, it seems like your passion shines through, and then you have these students who also have that same passion who are able to work under you. And I feel like we're kind of missing that at my institution. So if you don't mind for us to still help, even though we're not in New York, that would be wonderful. And I would love to connect our—
Yeah, great. Thank you, Alia. First of all, in answer to your question, yeah, once this formalized, I think, Katie, you should get everybody's email. So then, you know what, I'll send you the information. And you know what, it's like mighty drops of water, tiny drops of water make a mighty ocean. So we all, and these people, they have nothing, because the person who reached out to me was one of the former ambassadors whom I've worked with for a while in the UN. And now he went back to his country's, advising. And then I spoke to the First Lady the other day, that Dr. Chen and I had a conversation with her. And then the main thing they have a terrible lack of sanitary pads for young girls, especially those growing up in orphanages, because you know what? The pandemic doesn't stop periods unless somebody gets pregnant. So I think it's such an indignation not to have a pad. So, I always think like, oh my God, okay, well, like when I used to get my period, like if I didn't have a pad, what would I do? So, when you put yourself in that place, you start thinking. So with all the recyclables, so I think one of the things we're going to start thinking about is recyclable pads. So I know some of our students, like at one of the FAMWA meetings, we had some of the students who I think her mother started that, like, so the Days for Girls, they started making pads, and, you know, some of us bought those packages. So this is what we need to do, ladies and Bobby. So I'm not picking on you, but it's nice to have a guy there in the room, not fainting when we talk about sanitary pads, you know, because this is what we need to do. So to see how can we get that. So it's empowering. So that's what Dr. Chen and I, we're going to talk about it. Definitely, I want to make this a student project, and it can be replicated. Because do you know that even our own women here in prisons don't have access to sanitary pads? And the other thing I want to tell you is soap. Okay, now we're not going anywhere, but when I travel a lot, you know, and go for all the conferences, so I would keep begging them for soap every time in my room. Why? Because I would collect all those bars of soap. I don't use soap, I use body wash, but I would collect those bars of soap, those little ones they put in the hotel, toothbrushes, shampoos, and drop them off at homeless shelters or give it in prisons, because you know what? They don't have access to that. So soap is soap for hope. That's it. So it's so simple. So tell your family people, like I keep blasting periodically messages on Facebook or, you know, like what is that? WhatsApp, and now maybe Signal or anything I can. Hey, are you going somewhere? Can you get soap? And then if you go, you know, you travel on the plane, like how many, like especially you go business class, you get like all this toiletry kits. Okay, you take it, and I bring them all, and I'll ask my neighbors, are you going to use them? And I tell them, no, I'm not selling them, but you know what? It goes for a cause. So these are the kind of things you can do. And socks. Do you know there's such a need of socks? So these are the simple things you can think of. And one of the things my students did is they wrote letters to the local businesses. So post-COVID, we will have a post-COVID. It's not all that bad at some point, hopefully by this year end or next year, when we get back to at least a near normal as we can. So this is something you can think of. And also in answer, I know you said Bobby answered you, but in answer to that earlier, that Amazon, you can also pick the charity. I do that like on Amazon Smiles. But what we did is one of my students created the page, and we put up a list of what supplies were needed, so people could send the supplies directly to me. Like my office room, like I couldn't even sit in my office room, like, you know, people, and everybody knew, oh, it's going to her room. And then I used to store them in closets everywhere before they were sent off. We also did that when the Ebola pandemic came. So to Liberia, they had a lot of issues. So we launched a drive, and then one of my students, his mother worked in Japaigo. That's an initiative of Johns Hopkins. So we could again send them out through a container. So this is what I'm trying to say. You know, you just have to see, but locally also there's so much we can do. So there are two ways of creating a page on Amazon, or making sure when you buy, because I think except for perishable goods, we are all buying goods, we are all buying stuff from Amazon. So that's something you can think of doing. And also, you know, like that's the thing. Everybody, you don't have to give thousands of dollars. It's just like that little bit collectively can make a difference. And people can donate. Like, you know, the other thing I would suggest is like, after the post-COVID, is even to reach out to the people, you know, like Michaels and all these people who have all the fabric. Like, can they donate some fabric? Like, how do we make the pads? So donate fabric, and then reach out to Hanes to get panties, you know. So these are the kind of things which we need to be doing, because I think we really need to focus on this. It's also sustainable. And how many disposable pads can we supply them? And even if we have menstrual cups, that's what I was telling Dr. Chen. And like once we had some samples of menstrual cups, but how can we send them to Nepal because they don't have water? So you'd be actually introducing infection because these girls and women couldn't clean it. So when you're thinking of something, it has to be practical. You cannot give them a device which is iatrogenic. It's like people going to the hospital and ending up with COVID, or, you know, something else like MRSA. So that's what I'm trying to say. Okay.
Thank you for that. Nina also had a question regarding like short versus long-term impact. So she asks, do you think that making short-term and or small contributions to bettering global health is better than working on a way to contribute in a more long-term and sustainable way?
Okay, so here's the deal. So short term can take, it's like putting a Band-Aid on a small cut, right? But you cannot put a Band-Aid on a major abscess you have drained. So one of the things is sustainable. For example, if we can get funds to get like sewing machines and teach these girls and women to make these recyclable pads, if, you know, it's not rocket science. If somebody can use the cloth to make a recyclable pad, why can't these people use it, right? Mm-hmm. So yes, immediately, but we should talk about sustainability because you can teach somebody to fish and bake. You can't fish or bake bread for them every time. Absolutely. Because there's a finite, because these supplies are finite, they're not infinite, right? So that's why I think it's important, the transfer of knowledge or tips to somebody else. Like by sharing this with you, I'm not losing anything. Actually, I'm gaining it, like, because we're all coming collectively and you'll tell somebody. So this is like a movement, you know? Absolutely. It's like grassroots because we're working at grassroots. So that is the importance in public health is grassroots efforts because they lay a good foundation.
Tying into that almost directly, you're talking about how just through this webinar, everyone in attendance has been able to develop some form of connection to build our reach and our impact. Nina had a follow-up question that whenever you mentioned getting in touch with contacts to find ways to contribute being important, how as medical students can we build that network of contacts?
Okay, so what we have to do is like you got to look into, talk to your professors, talk to your advisors. You know, there must be somebody, you said that you don't have a global health program, but there must be somebody going to do mission work, you know, medical missions. A lot of us physicians go on medical missions. So talk to them and the medical brigades, I'm sure. So that's the way you build up your network. And by becoming members of FAMWA, student members of FAMWA. So that's what we do. Like for this, for example, now, whoever's interested, Katie, like down the road, you or Nina will get in touch with me. And then we'll say, okay, once we have the plan, so this is the plan. So how are you guys going to do? How are you going to take it and run with it? See? So there needs to be a certain amount of a framework laid, but then you give it to the person so that they come up with ideas and see how you can do it. For example, like we want to make recyclable pads. So those, okay, so what are your ideas? How do you think you can get the material for the pads? Who can you reach out to? Like, can you reach out to any, you know, the local churches? Would they be interested? Would the women be interested in sewing pads? Or, you know, your local like clubs? So this is what, like a student activity. I'm sure you have student clubs.
Absolutely.
Don't you? In medical school. So just join something and do that. So you just have to pick one thing, because that's what we do with our students. Like they pick one thing. Oh, this is what we're going to do. Okay. And then you run it by your advisor, and then you look at the feasibility. Because remember, a lot of times the student run clubs, you cannot have commercial sponsorship unless it's vetted by the dean of students or the legal. So that's the thing. Like suppose, you know, McDonald's say they want to make that, but we want to put a McDonald's banner in your school. So we can't do that. So that's what I'm trying to say. So talk to a person, but privately outside your school, like as a cohort of medical students, private individuals, you can reach out. And there's power in number, you know?
Absolutely. One thing that I'm interested in learning about more from your experiences is, I guess I'll ask several questions in one and let you just kind of take it in whatever direction you'd prefer. But did you always know that you were going to pursue global health? And if so, and or at what point in your training did you really begin to have an impact in global health? And how has that impact waxed and waned throughout the different time periods?
Okay, so in answer to your question, I think I was born with an activist gene because I was always like, like, I guess, intrigued. And so I had kind of a unique upbringing because, growing up in India, like my parents used to host so many people who used to come from overseas, and especially a lot of students, they would come and stay in my parents' house. They had like a big house because they would save that money and travel. And when talking to them, I would realize how their healthcare is different from our healthcare. And then, once I finished medicine, did one residency, and then lived abroad for some years, like overseas from India. And then I always was interested in why is it that one community, even when I was young, I used to do like work on a lot of preventive medicine camps, In India, they used to call it social and preventive medicine. And I always used to think like, why is it one community is healthier than the other? So I started looking at social determinants. This is long before, this was like in the, I would say 80s, not now, like so many years ago. And then after I did my medicine and everything, and I realized that it's just not one patient. We need to focus on community. And so I did a backtrack. So then I did my MPH, I did my master's in management. And then I go like, okay, so in order to do something, you need to get to point A and B. And let me tell you, my interest has never waned. If I win the lotto, I just quit working altogether and just start focusing on global health to see how can we go from point A to B and, like kind of build up a band of people who can just like take this forward, because global health is it's not static. It is like a video. It's like a movie you're watching. But one thing is, the needs do not change. They just differ. Sure. Because we have a broken healthcare system here, which has got even more broken now. I mean, it's ridiculous that we have over 400,000 people dead. I mean, you don't know whether to laugh or like pull your hair or do something. And they're all people.
Yeah.
And you know what bothers me? The healthcare providers are so much at risk. And why is it they are giving healthcare providers injections first? Because they need us to be healthy to work, or anybody working in the hospitals. It's not that because they love you. It's simple.
Right.
It's elementary. So because we are not, at this point, we are indispensable.
Right.
Because a computer scientist cannot take care of a sick person. Mm-hmm. So what I'm trying to say is, I guess I always had this passion, and it's like, and then when I started looking around, I go like, is anybody listening to me? And I realized that being persistent, polite, but at the same time, getting the message across, like, you better listen to me. So that's it. To a certain point, you got to be tough.
Yeah.
I'm not saying you need to be a bully, but you need to be firm to say that this is what it's happening and this is how we do it. And I'd like your help to help me, go to the next step. So I hope I've answered your question.
No, absolutely. Thank you. Another question that came to mind was that whenever, I guess we're talking about global health, just on a very foundational level of someone who's first considering pursuing global health, at least in my mind, the act of going somewhere and providing healthcare services is what comes to play first. How were you influenced to take more of the advocacy, the action, the reaching out to the different communities? How did you first get your foot in the door of doing that? Was it just through traveling and like starting small and developing your network, or?
Yeah, I guess so. Like, I think one of the things also, basically, I'm a people's person. My late dad used to say, if you throw her in a desert, she'll find somebody to talk to. So, I mean, that's my personality. See, but everybody has different personalities. So I found that you have to communicate. You have to develop a communication. And that comes with Practice. It's just like the first suture you put will be crooked. The 10th one you put, you really get it neat, like when you hold the needle holder and you know how to do it. But that, okay. So the important thing is, because now you have so much more of an advantage, because you can communicate with like-minded people through various social media, through platforms. So that's a way of reaching out, and that's what I'm saying. It's just not about money. It's also giving your time. Absolutely. So that's the way you really reach out to people. You start developing it. If you're on Twitter, if you're not, I would strongly suggest you all join Twitter, because it's so, and they're not paying me to talk about it, but I'm just saying it's so nice, because you start, like, you see, oh, somebody's doing this, more than LinkedIn, more than Facebook, I think Twitter, because you just share a bitly, you want something, it comes across.
Absolutely. And you spoke,
for example, we're doing a panel. Actually, I contributed to a book. Oh my God. I think I've been writing like a maniac, the COVID thing. Yeah, like I had 2 books published, and then so I contributed a chapter on menopause. The reason I'm bringing it up is as a human rights issue. I think menopause is very much a human rights issue. So there is a webinar coming up, and somebody in Singapore is doing it. So I would suggest, Katie, I will send you the link, because I have your link. It's on Friday, but it's 6 a.m. because Singapore time, New York time. But so it's 5 a.m. But listen, you guys do all nights for that. But because that's a way you will make contact, because you see somebody there, you send a message to that person, you say like, oh, this is what, like, that's a great way of connecting.
That's a wonderful point. In a conference or a webinar that you spoke in last week or the week before.
Which one? The one with my book?
Yeah, I think so.
Okay. Oh, yeah.
I can't remember the specific title, but
yeah. Public health and
chapters
technology.
And
yeah. That was the book.
Yeah. You spoke to the importance there, I believe, or someone had, about technology and how there are pros and cons. One of the advantages that we have is we get almost unlimited contacts, but also like news in real time. And so whereas people used to have to depend on like turning on their television and going through the steps of, whatever the news was, then the news reporter had to fly there and give us the information. We can hop onto Twitter and see what's trending and get all of our news almost in real time.
Oh, well, now I'm going to be off CNN for 10 days. I've had enough of CNN. All this, you know what? There's a new administration. Let's see what his global health policies are. I want to see what he's going to do with the global gag rule,
Right.
So let's see. But apart from that, you can shut yourself off. But it's not only the TV, because I feel they cover a lot of rubbish. They don't cover like what is really happening out there, what can do, and they interview the same people till you could be screaming. And I was talking to somebody, they go like, yeah, we could be screaming. So I think it's at the end of the day, global health is also about showing respect and getting respect.
Absolutely.
Because it's a whole lot of things, because it's a movement. And for any movement to be successful, you get you need to show respect and make sure you get the respect. That's what I said. Like in July, I think I was on a panel with Fauci by the UN. And the reason I'm bringing it up, because I go like, wearing a mask is respect for you and respect for me. And like CNN picked it up, and I go like, and everybody goes like, oh, Cuomo's. I said, yeah, if Cuomo's tweeting it, it's what I said first, and they picked it up. So what I was saying is, the communication is important. The reason I brought that up is just not to like blow my horn or something, but just to say that sometimes, the catchy phrases get picked up. So this is what I'm trying to say. If you like, when you're talking about like, for example, pandemics don't stop periods, people will go like, yeah, you're right. See, something like that, that's self-explanatory. Like all along, we're thinking of this, you're thinking of that, but they don't. And the same with the domestic violence. That's why you have so many, there's a way, there's a help, there's a reach, especially if you are 24/7 with somebody you can't get out, you've lost your job, or so there's so many things.
Definitely. I think that we're getting close to the end of our webinar. So our population here is that, we're medical students, we're interested in pursuing global health. What advice would you give us at this stage of our career to, I guess, better our understanding, our opportunities that will be available better later on, to kind of facilitate how we can impact the world?
Well, I would say that have webinars, talk to people, because usually, however busy you are, at least I can speak for myself, I always say, okay, I'm always happy to talk to students, because if something comes out of it, it's very fulfilling. The other thing, as I said, is look, there are so many groups out there, even for global health. Vet them. The important thing is to vet it, because at this stage in your careers, you need to focus on school, completing your boards, getting a residency. But at the same time, in order to broaden yourself, and it is just not as, look, the whole concept of one patient, one physician is outdated. It's like you need to have a community-based focus. I don't care if somebody else tells you that, but I could have a head-on debate with them, but that's not the way you need to tell people. It needs to be community-based focus, and human rights. That's so important, because global health is very much about health inequities and human rights. So, pick up books, read them. There's so many books, like do a Google search. Let me share an example. The first book I wrote was Women's Health and Human Rights, and it's still there. It's like around, even after 10 years. The interesting part was I wanted Fred Tsai, who was a known public health person. He was a gynecologist from Ghana, trained here. He passed away. He passed on. And this was more than 10 years ago. So when I went to Ghana, I said, can you write a chapter for my book? So he said, why do you want me to write it? I said, because you're from Africa and you can talk about it. And I don't want somebody from the internet writing it. He said, okay. And that's it. So I told him that. So you have to be bold. You need to talk. And I had Amartya Sen and Farmer and his wife gave me a chapter. The reason I'm saying that is when I started it, check it out. It's really a cool book, because like Alan Rosenfield, who was a guru to so many of us, he died. He was the dean of Columbia University. It's called Women's Global Health and Human Rights. It's on, I think it's on Amazon. Or you can even, it's on Kindle. The reason I'm saying that, if you read a book like that, and there's some, like Paul Farmer's book, because it starts telling you what global health is. So what you can do. So I think that is, I would say, just, read stuff. It's so important. Have webinars, listen to it. For example, if you guys can be up at 6 or whatever your time is, 5, it's worth it, because you have different people, like you have a Canadian, you have me, you have somebody else, and somebody else from Singapore. So that's the whole point, So, and Absolutely. I'm going to, I will email you the link, because it's on Twitter. I'll just copy it and So anybody on Twitter, you should join Twitter. It's really good.
I would agree with that.
It's a lot of stuff you get. Wonderful. Anything else?
No, so I guess in conclusion, if you will, at some point in the upcoming weeks, send myself, Nina, and the other fellows the information about the, including students on the recyclable pads initiative.
Once I get that, no, not next week. It'll be, because Dr. Chen and I are having our initial thing. We're coming up with the framework, then you will. It may not be next week, but it will be in the near future, because we want to take it off the ground as soon as possible. Oh yeah, definitely. I will send you guys an email, and you can share it. I think I see one last question here. Something just popped up.
Yeah, so Sahibanur, I will send you information about you're talking about the Ann Carter Fellowship?
Or actually, so at the beginning, I couldn't really I was eating dinner, so I didn't fully hear. I heard you mention a fellowship about global health. Was that like?
Yes, so that's through AMWA, and the applications will open up in the fall. And so if you scroll up in the conversation, Nina included a link to our fellows blog, and you'll find more information there, but I can just send it to you after we're done here.
Okay.
But so as soon as Dr. Murthy passes that information along, I will send it all to you. I believe that you all should receive a link of the recording of this meeting, but if not, that will also be uploaded to our blog. And does anyone have any last minute questions before we conclude? No? Okay. Well, thank you again, Dr. Murthy.
Okay,
I appreciate it so
Good
much.
luck. Bye. Stay safe.
Thank you
Everyone
so
have a good
much.
evening.
Have a great night, everyone.